So here I am logging in. I was sent an email and now I'm going to log in to their website to go to my appointment, and here I see go to appointment. It says welcome. Your appointment is at 27 March at 1:15. You can now enter. So I'm going to click go to your appointment, and then a little box comes up to open my virtual visit, which I clicked on, and now I'm connecting. Now I have a message, welcome to my virtual visit. I am now in my visit in the waiting room, and my provider will be with me shortly. So that's what I'm waiting for, and there he is. So now I will hit join with computer audio, and I see my doctor, and I am used, and we should be all set.
Hello Angela, how are you doing this morning?
I'm doing fine. I have a little knee pain. That's what I'm here for, to talk about how my knee is hurting sometimes when I'm sleeping and when I'm walking. I don't know what the problem is. I do walk a lot. I do exercise, and I found my knee is clicking a little, and I have some knee pain.
What have you done for it so far? Have you taken any Tylenol or anti-inflammatories like ibuprofen or Aleve?
Only when it's hurting really excessively. I try not to take a lot of pills. I don't know if they're good for me or not, so I don't do a lot of that, no.
Have you done any physical therapy formally, or have you just done exercises and things on your own?
I have not done any physical therapy, no.
And have you had any treatment on this knee previously, or is this a relatively new problem?
It's a relatively new problem.
Okay. And I believe your primary care doctor got an x-ray for us, is that correct?
Yes, he did. I think you should have that.
Okay. Yeah, we do. And then can you just show me where it's hurting right now? Like if you had to point on your knee where it hurts, can you show us?
Yes, I can. It's like on the inside of my knee, like and down below, and it makes a clicking noise sometimes. And I do have trouble sleeping. It does keep me awake.
Can you bring your knee out as straight as you can for us, please?
Okay.
And then bend it back as far as you can. Okay. Then have a seat for me.
Okay.
All right. So what I'm going to do now is I'm going to show you your X-rays.
Okay.
All right.
Oh.
So can you see the X-rays on your screen now?
I can. Yes.
Okay. So if we look at your X-rays right now, this is your right knee that we're talking about. The X-rays are reversed, but if you look at the little tag, there's a nice little R up there. And what I see on your X-rays is I see osteoarthritis.
Oh, okay.
So you've got decreased joint space on the right knee compared to the left, where there's a nice even space. There's some extra white density here, which is called sclerosis, and you can see little bone spurs that have formed here and on the outside. And now, if we look at the other views of your knee, back underneath the kneecap from the side, this is looking at your knee from the side. You can see again, underneath the kneecap, there's significant arthritis here with some bone spurs that have formed. So ultimately, we need to treat you for osteoarthritis. The way that we treat osteoarthritis is with a combination of things. There's 4 things we do for everybody. Start with physical therapy, which is going to aid in strengthening your knee, reducing micro instability. I do generally recommend that everyone tries 2 or 3 visits of formal physical therapy to learn to do exercises correctly, and then we move on to a home exercise plan. The most important thing about doing physical therapy is doing it on your own daily. If you're only doing therapy while you're in therapy, it's not going to do enough for you. Then I would start an anti-inflammatory for you. So ibuprofen or Aleve is an over-the-counter anti-inflammatory. They have some side effects which we can review based on your history, but in general, they'll offer significant relief in your pain. And if an anti-inflammatory is not appropriate for you, then we talk about Tylenol instead. Weight loss is the next thing we talk about doing. Weight loss has a huge effect on knee pain. Every pound that you lose will take 4 to 5 pounds of stress off the knees, but particularly in deep flexion and in stairs. So if you do 10,000 steps a day and you lose 10 pounds, that's a 50,000 pound force reduction on your knee every day. And then the final intervention that we offer is usually injections, which are usually cortisone shots. Cortisone is a strong anti-inflammatory. We can place it directly in the knee, and it's usually the most immediate relief to get faster knee pain if you're unable to tolerate therapy in the short term. When all of those things fail, that's when we then go on to talk about surgery, which in your case would be knee replacement. And that may be something you need in the future, but as you've only been having symptoms the last few weeks, I don't think that's something we need to talk about right now.
Okay, so can I continue with the exercise I'm doing, or I should stop that and just do the physical therapy?
So I think you're okay to continue your current exercise program, but you do want to get the exercises that we're going to send to you, and you do want to start a little course of physical therapy, whether it's just 1 or 2 visits or a formal course, depending on your comfort level with the exercises and your improvement in pain control with them. Usually I tell people to do as much as you can tolerate doing. You're usually not going to cause any harm in this kind of scenario.
Are you going to send a script for PT to me?
Yes, we'll send you a prescription for physical therapy, and we'll also send you our home exercise program for knee pain for osteoarthritis.
On my email, that type of way, or how will I get
send
that?
it physically to you in the mail.
Okay, thank you. Okay, sounds reasonable. I guess I'll try it and see what happens, and we'll go from there.
Okay.